We understand that you and your child may be going through a difficult time. The Children's Cystic Fibrosis program is part of your support system. We believe that treating your child involves the whole family, and our team strives to work with you to provide the most comprehensive care possible.
We have locally a family advisory council, and that's been really great. We're both involved in many areas of CF, but this one for me has been so amazing because we've had the chance to develop hospital guides for parents or families who are going into the hospital for the first time, or maybe it's been a long time and they don't really remember, and glossary of medical terms that they might hear. So they're not feeling so overwhelmed, or they don't, a lot of people are intimidated by doctors, especially if there happens to be a doctor in the hospital that they're not used to. They can just look in their guide and get their answers and kind of empower the family to feel like they're the advocate, which is what we are.
Cystic fibrosis is a chronic disease, and it really consumes the lives of the families and the patients to a large degree. So we have our CF Family Day, Family Education Day, every year, and those Family Education Days will have a number of different speakers, and so we'll have a speaker or two who really address medical issues. Then there are other pieces that are important as well, and so we will have a psychologist who will come and speak about perhaps feeding problems in the care of toddlers. There's lots of things to talk about. There's lots of things that we can help provide resources about, and that a number of people want to hear. And so being able to do that in the context of the Family Day makes it a useful and enjoyable sort of event.
Can you tell me what medicines you take?
I take...
One thing that I love that Children's does at our clinic is that they're really talking to our sons about their health care, and not just us. The pharmacist, she'll come in and ask the kids, what medications are you taking? And she makes them sort of be accountable for knowing what they're putting in their mouths. Why do you have to do your vest? Well, I have to do my vest because it shakes out the stuff that we can't cough out, and it keeps us healthy. And they're doing that kind of stuff that I love.
The doctors are phenomenal, and when John has an issue, which we started to see a drop in the pulmonary lung functions, and they were so proactive with it and added medications, changed medications. It's like they know that disease so well.
There would be no way to manage a disease like cystic fibrosis without a health team that we have, such as we have at Children's. There's just so much to the disease. Like I said, there's so many different aspects. And the whole physical thing aside, you can only imagine too that insurance and co-pays and things like that are sometimes a very tangled mess. And so that's when the social worker steps in. That whatever problem, whatever issue you're having with this very complicated disease, there is someone on that team that knows what to do with the problem.
It's kind of like having your own personal GPS system. We know where we want to go, we know where we want to end up getting, but we don't know the best way to get there. And when we run into roadblocks, we don't know the easiest way around it. Children's does that for us. They give us that personal GPS system to make sure that we're going as efficiently as we can on the path that we're following.